Hey, what's up, guys? Welcome back to my channel. In today's video, we're going to talk about the causes of renal failure. First, let's understand what renal failure is. Renal failure is a condition where your kidneys stop functioning correctly, leading to a buildup of toxins in your body. Renal failure occurs when your kidneys lose their ability to filter waste and excess fluid from your blood. It can be either acute or chronic, and it's a severe condition that requires immediate medical attention. If a patient has renal failure, we can construct a differential based on using a mnemonic, I chase a rising bun, which lists specific causes of renal failure. Let's start with prerenal causes, which are due to decreased blood flow to the kidneys. This can be caused by I. Intravascular volume depletion, dehydration, third spacing. This is a condition where your body is losing more fluids than it's taking in. This leads to decreased blood flow to the kidneys, causing renal failure. C. Cardiac causes, CHF, MI, tamponade. Cardiac causes like congestive heart failure, myocardial infarction, and tamponade can lead to decreased blood flow to the kidneys, causing renal failure. H. Hepatorenal syndrome. This is a condition where liver failure leads to renal failure. A. Arterial disease, renal artery stenosis. Arterial disease like renal artery stenosis can lead to decreased blood flow to the kidneys, causing renal failure. S. Shock. Shock is a severe condition that leads to decreased blood flow to the kidneys, causing renal failure. E. Eclampsia, obstetrical complications. Eclampsia is a severe complication that can occur during pregnancy. Moving on to both prerenal and renal causes. Next, we have prerenal and renal causes, which include A. Acute tubular necrosis. ATN, in a sense, can both be and renal. In etiology, ATN is a condition where the cells that line the renal tubules die due to lack of oxygen or blood flow to the kidneys, toxins, or infections leading to renal failure. Now let's talk about renal causes. R. Radiographic contrast and other toxins, drugs, rhabdomyolysis, hemolysis. Certain drugs and toxins can damage the kidneys, leading to renal failure. I. Intrarenal emboli such as cholesterol, DIC. Intrarenal emboli can obstruct the blood flow to the kidneys, causing renal failure. S. Scleroderma. Scleroderma is a connective tissue disorder that can lead to renal failure. I. Interstitial nephritis. Interstitial nephritis is an inflammation of the kidney tissue, leading to renal failure. N. Necrotizing vasculitis such as polyarteritis nodosa, Wegener's. Necrotizing vasculitis is a condition where the blood vessels in the kidneys become inflamed and damaged, leading to renal failure. G. Glomerulonephritis. Glomerulonephritis is a condition where the tiny filters in the kidneys become inflamed and damaged, leading to renal failure. Lastly, let's talk about postrenal causes. B. Bladder obstruction, usually prostatism, sometimes blood, pus, calculi. Bladder obstruction can lead to renal failure if urine backs up into the kidneys. U. Urethral obstruction caused by calculi, retroperitoneal fibrosis, cancer. Urethral obstruction can lead to renal failure if urine backs up into the kidneys. N. Necrosis of renal papillae caused by diabetes, sickle cell anemia, NSAID abuse, infection. Necrosis of renal papillae is a condition where the tissue in the kidneys dies, leading to renal failure. So in summary, We have the mnemonic, I chase a rising bun, which lists specific causes of renal failure. It's important to note that these are just some of the causes of renal failure, and there can be many other factors that contribute to this condition. That's it for today's video. I hope you found this information helpful. Don't forget to like and subscribe to my channel for more health-related content. See you in the next one.